This conference will now be recorded.
So today's practical is about serous cystadenoma of ovary. So what is serous cystadenoma? See, the name itself contains three parts. So it contains a serous part, it contains a cystic part, and it contains a adenomatous part. So what is it? So ovarian serous cystadenoma, and less precisely known as serous cystadenoma, is the most common ovarian neoplasm, which is representing over 20% of all ovarian neoplasms, that is both benign and malignant. So it forms 20% of both benign and malignant ovarian neoplasms. So what is a serous cystadenoma? The oma itself represents it is benign. So it is a benign ovarian neoplasm. It has a very superficial resemblance to the most common type of ovarian cancer, that is its counterpart, serous carcinoma of the ovary. So they both superficially look like the same under a microscope, but however, it doesn't have the characteristic malignant features. So what are the characteristic malignant features? We will see atypia, loss of polarity, we will see mitotic figures, we will see those mitotic figures which are really atypical, and we will see increased nucleus to cytoplasmic ratio. We will see hyperchromasia. What is hyperchromasia? Means there is nothing but if we do HND staining, it will be the chromatin will be more basophilic. That is hyperchromasia. These are the characteristics of all our malignant features, which are absent in benign. So it is virtually impossible to mix up with its malignant counterpart, because as it doesn't contain the previously described features, and it does not share genetic traits of indeterminate serous tumors, also called serous borderline tumors, that may transform into serous carcinomas. So that's the reason why we kept it as a separate entity. Even though it is this comes under the epithelial tumors of the ovary, which are benign. The serous borderline tumors and serous carcinoma comes under malignant. The serous borderline tumors, they can be intermediate. Even though initially they are benign, they may transform into malignancy. So they are considered as precancerous lesions. So serous cystadenoma of the ovary are not related to serous cystadenoma of the pancreas. We had serous cystadenoma in most of the areas. We can have it in the cervix, we can have it in the fallopian tube. Even though fallopian tube, cervix ones and ovarian ones resemble the same, these are different from the serous cystadenoma of the pancreas. That is, the presence of an ovarian or pancreatic one does not suggest the increased risk of others. But in the case of fallopian tube and cervix, there can be increased risk, there can be association. We can't say it has an increased risk, but we can say it has an association between them. So coming to the diagnosis. The diagnostic processes, before going to diagnosis, I just want to tell about epidemiology. The ovarian serous cystadenomas account for the largest proportion of the benign ovarian tumors, making up to 50 to 80% of all benign epithelial ovarian tumors. As I previously told, serous cystadenoma is an epithelial tumor, which is a benign one. It accounts up to 50 to 80% of all benign epithelial ovarian tumors, and the prevalence peaks between 60 to 70 years, and serous ovarian cystadenomas account for 25% of the serous tumors. So coming to definition, it generally includes cystadenoma, cystadenofibroma, adenofibroma, papillary cystadenofibroma, papillary cystadenoma, and papillary adenofibroma. See, all these entities means these papillary entities nothing but they are the previous ones with a papillary configuration in them. So the term usually depends on the relative amount of fibrous stroma, but distinctions are often arbitrary. These are benign. These are more 10 to 20% bilateral. Most often they are unilateral. Most are partially or completely cystic. That's the reason why they are cystadenomas. In cystatic, if anything contains cyst, they contain cystic portions, right? So it may be complete or partial. And these are usually less than 1 centimeter in size. If the size is less than 1 centimeter, it signifies a cortical inclusion cyst or endosalpingosis. As I previously told, these serous cystadenomas can also seen in fallopian tube. If the size is less than 1 centimeter in fallopian tube, we call it as endosalpingosis. If the same thing occurs in ovary, we call it as cortical inclusion cyst. So coming to the diagnosis. The diagnostic processes includes initially ultrasound or color droplet. What are the clinical features in a ovarian cyst? If the cyst is very large, we can usually have, what are the complaints? We can usually have dysmenorrhea, irregular menstruation, pain abdomen. If the cyst is usually large, we can expect a torsion. So the diagnosis, after these clinical features, the initial diagnosis is made by ultrasound. Color Doppler is used for any torsion and to know about the size and nature of the mass, and sometimes CECT abdomen can also be done. Blood investigations include CA-125 levels for screening. CA-125 levels increases in malignancy, and further CEA, beta HCG levels, alpha fetoprotein, CA-99 and LDH levels to confirm the diagnosis. Serous cystadenomas are diagnosed by histomorphological examination. As they are benign, all the blood investigations will be in the normal levels. So we will diagnose serous cystadenoma by histomorphological examination. Grossly, they are usually small unilocular cysts that contain clear straw colored fluid. Sometimes they may be multilocular. Most often they are unilateral, 10 to 20%, they may be bilateral. So coming to the gross description, as I previously told, there will be 6 entities. There are cystadenoma, cystadenofibroma, adenofibroma, papillary cystadenofibroma, and papillary adenofibroma. So what is a cystadenoma? It is usually 3 to 10 centimeters large, oval to round, smooth, glistening surface, usually watery clear to pale yellow cyst fluid. But it can be all the time, it can't be a serous. See, water is nothing but we will say it is serous, but sometimes it could be viscous or mucoid. So what is a cystadenofibroma? Cystadenofibroma contains solid areas along with the cystic areas. So it varies from solid areas to cystic areas with knobby papillae to confluent firm mass. If the papillae are present, it is papillary cystadenofibroma. If there is only confluent firm areas, then it is plain cystadenofibroma. So what is a adenofibroma? It is entirely solid appearing, but sometimes there may be small areas of cyst or gland. If surface papillary projections are prominent, it is papillary adenofibroma. We will write the description as papillary serous adenofibroma. So papillary tumors have papillary projections on the outer surface or protruding into the cystic cavity. As I previously told, cystadenofibroma has cyst-like areas. So this cystic area is lined by epithelium, right? That epithelium will be folded as papillae. That's the reason why we give the name papillary cystadenoma or papillary cystadenofibroma or papillary adenoma. The outer surface or the lining epithelium which has papillary projections, they are called papillary tumors. So in a papillary cystadenoma, it is same as cystadenoma with cystic spaces containing intracystic papillary projections lined by clear cells. In papillary cystadenofibroma, it contains both epithelial and fibrous components. They are predominantly cystic with a variable amount of the solid components. These cystic areas, as I previously told, they will have papillary projections. And coming to papillary adenofibroma, these are predominantly fibrous and small portion of glands and cysts with papillary configuration is seen. So that's how they will be. All these configurations will be noted in microscope, not on gross. On gross, you can say the size, shape, and consistency. Either it is cystic or solid or mixed. And the color, which color it is there any additional hemorrhage, areas of necrosis, etc., etc. Okay. So how they will be microscopically? Microscopically, the cyst lining consists of a simple epithelium. The lining cells are either be columnar and tall and contain cilia, resembling normal tubal epithelium if it occurs in the fallopian tube. If it occurs in the ovary, the lining epithelium is cuboid and have no cilia, resembling an ovarian surface epithelium. They will contain the normal epithelium of the concerned organ. So coming to the microscopic or histological description. Usually they are small, uni to multilocular cells lined by single layer of tall columnar ciliated cells resembling the normal tubal epithelium or cuboidal non-ciliated epithelium resembling the ovarian surface epithelium. And the stroma contains spindle fibroblasts. If papillae are present, they are simple papillary processes. There will be no atypia, no architectural complexity, and there will be no invasion, which are seen in the malignant one, that is the borderline serous one and serous carcinoma of ovary. Adenofibromas and cystadenofibromas are composed of predominantly fibrous stroma with minimal component or minor component of glands and cysts. These glands and cysts, these cysts are lined by the epithelium. They show the papillary projections, then they are called papillary ones. So this is the gross image of the serous cystadenoma of the, see, this is the normal cyst which we have in our lab. This is the epithelium. You can see it's a lining epithelium. This is before rupture. You can see this is a solid area, cystic area. Most of, if we cut it, we will drain. We don't know what kind of, it can contain a serous fluid, a mucinous fluid, or a viscous fluid. So this is a serous cystadenoma. So this is a serous cystadenoma. This is the lining of the cyst wall, which is smooth and glistening. So coming to microscopically, see, this is the cyst wall. This is the normal ovarian parenchyma. This is the cyst wall. This pink one is the cyst wall. This is the cyst wall. And this is the underlying stroma showing fibroblasts. These long spindle ones are the fibroblasts. This is a fibroblast. This is a fibroblast. These are the fibroblasts, and this is the lining epithelium. See, these are cuboidal cells. You can appreciate them very well. These are non-ciliated cuboidal cells. So this is the lining epithelium of the cyst wall, and this is the underlying stroma, which contains mainly fibroblasts, spindle-shaped ones. So the underlying stroma is fibroblastic, and the lining epithelium is cuboidal. And this is the area of hemorrhage. You can expect a blood vessel. So this is a papillary serous system. See, it is thrown into foldings like papillae. The lining epithelium is thrown into folds. So this is a papillary one. So this is a normal serous cystadenoma. This is a papillary serous cystadenoma. This is the cyst-like space. All the fluid is drained out. So this just this lining. This lining contains columnar epithelium. You can appreciate that these cells are long, tall. So this is a columnar epithelium, and this epithelium is thrown into folds representing a papilla. So this is a papillary serous cystadenoma. Thank you.